Hello, welcome to the James Cooley Show. It's your life. I'm your host, Dr. James J.C. Cooley, and wow, I know everybody like, wow. You know why I'm wilding? Because it's Wednesday, 360-degree health. And you know what that means. I got my main man, Dr. Michael Mantell, here today, and he's going to bring another topic, another absolutely world-class guest to talk about things that we need to get a better understanding of and educate ourselves. I said educate ourselves and educate others around us, and just get a feel of a lot of different things that are happening in society and some of the things that we can do. So I tell you what, Dr. Mike, how are you doing today? How are you doing?
Great, just doing great. And I'm so eager to dive into this topic. It's a topic that's not a comfortable one to talk about, because so many people have experienced it. There's stigma, there's real pain. And so we're going to uncover it in a gentle way and help people understand how they can improve their lives, even though they may have experienced some of these issues.
Absolutely. How you doing today, Dr. Michelle Cooley? How you doing?
I'm doing great, James. Really excited to have the guests on today. I love 360-degree health days. It's so
I do too. Hey, Todd, how you doing back in the studio, California studios, that is?
I'm always good. And what do you say? You ready to lock in this?
I'm ready to do it, man. Let's do it.
Here we go.
TV/Zumo. It's Your Life is sponsored by James J.C. Cooley.
Dr. James J.C. Cooley. The James Cooley Show. It's your life.
Hello. Welcome to the James Cooley Show. It's your life. I'm your host, Dr. James J.C. Cooley. And today is 360-degree health. And so you know what that means. Dr. Michael Mantell. How are you doing today, sir?
Doing great. It's 360-degree health day. And so it's a great day to learn and to grow healthier.
And we got this absolutely fantastic guest that's going to be on sharing a lot of the things that she is doing. I think this young lady wear about 5 or 6 hats, but we're going to get off into all of them. How are you doing today, Dr. Cooley? How you doing?
I'm doing great, James. You're right. This guest today, she wears many hats, and we're just excited to hear her talk about the topic I will be addressing in less than a minute.
I tell you what, whichever platform that you're watching us on, whether it's E360 television, Transfer TV, YouTube, LinkedIn, uh, Twitter, and over 68 live different platforms. Welcome to the show. And if you want to be part of the conversation, all you have to do is just go to the platform that you're watching us on, ask any question in the comments portion, and we'll get you an answer. Or I can do one better than that. You can pick up the phone and dial 1-888-344-1170. Again, that's 1-888-344-1170. And Tar will pat you through. I tell you what, Michelle, I'm excited about the show. Can you do the honors introducing the topic, the title, and introduce this absolutely wonderful guest?
Yes, most definitely. So again, it's 360-degree Health Day. And the title of today's show is The Effect of Adverse Childhood Experiences on Adult Wellness and How Health Disparities Perpetuate a Cycle of Illness. So, Dr. James Cooley and co-host Dr. Michael Mantell, they're having a sit-down discussion with Dr. Verena Brown. She's a pediatrician, health and wellness coach, certified nutrition coach, and a certified sexuality educator. She's going to talk about what are ACEs, which is adverse childhood experiences, how do high ACE scores affect adult health and wellness, and poor access to healthcare perpetuates a cycle of illness for adults and future ACEs for children. So again, Dr. Verena Brown, she's MD, CSC, NASM, CNC, FAAP. She's a pediatrician, health and wellness coach, NASM, certified nutrition coach, and AASECT, certified sexuality educator. As a pediatrician, she specializes in cases of child physical abuse, sexual abuse, and neglect. She obtained a Bachelor of Science in Biology from the Georgia Institute of Technology and attended medical school at Mercer University School of Medicine. There's so much to know about this guest today, but we're going to let her tell us. So please welcome to the show, Dr. Verena Brown.
Thank you.
Hi there, Dr. Brown. Welcome, welcome, welcome. We have so much to teach us. We're just pleased that you're here.
Wow.
Thank you so much for having me.
It's an absolute pleasure having you on the show. And I tell you what, I'm excited. And just like what Michelle just did, she read all these different titles, and we're going to try to touch bases on all of them, because each one of them is important. So, Dr. Brown, could you tell our viewers and our listeners a little bit more about you? Where were you born? Where were you raised? What makes you happy? And why are you so passionate about what you do?
Well, goodness. First of all, thank you so much for having me on the show. This is such an honor, and I'm very excited to be here to talk about this, the subject I'm very passionate about. And back to your questions, though. So where I was actually born in São Paulo, Brazil, and I moved to the United States when I was 7 years old. I've lived most of my life in Atlanta. I moved around for medical training, but ended up coming back here. This is home. And why I'm so passionate about the subject, adverse childhood experiences, because I work in the field of child abuse pediatrics. I'm a child abuse pediatrician. A lot of people don't know what that is. But basically, I spend most of the time seeing kids and adolescents who have been victims of physical abuse or sexual abuse. And we see some cases of neglect as well, or children who there are concerns about those things, and we have to, see, is it really a child maltreatment situation, or is it a mimic of child maltreatment? And, for the other hats that I wear, I'm a sexuality educator, and I'm also a health and wellness coach. And that honestly came through from working with children and seeing the whole family unit and how important it is to take care of the whole person.
Wow. So you're based in Atlanta right now, I believe.
Yes.
So
yes.
Yeah, we were just there. Michelle and I were just there 3 days ago. So always coming to Atlanta, So I tell you what, I'm excited to hear about, just like I said, all of these different things, But I got to always throw a wrench in you before I turn it over to Dr. Mike.
Okay.
If you have one adjective to describe you and who you are and why you're so passionate about who you are, what adjective would that be?
Gosh, that's That's a really tough one. My name Verena comes from it's a derivative of the name Vera, which means truth. And given the work that we do, and always trying to learn new things, and always trying to educate myself in areas that I don't know much about, I think that is a fitting name, because I'm always trying to get to the bottom of things.
I'm gonna go ahead and add kind, caring, and compassionate. We haven't met, but it just comes right through. And someone who spends her daily life focused on victims of child abuse, adverse childhood experiences, has got to have a caring heart. So, JC, there you go. We got a couple of different adjectives to describe our wonderful guest. Let's dive in, Dr. Brown. So, first of all, tell us a little bit about what a adverse childhood experience is. You use the expression child abuse, but perhaps you can dig into that a little bit more. What is an adverse childhood experience, ACE?
So we'll call them ACEs for simplicity, because it's a lot to say, a mouthful. But so ACEs is not just about any particular kind of child abuse, although child abuse is an ACE. So back in 1998, Dr. Vincent Felitti, who was actually in California doing work with Kaiser Permanente, and then joined work here at the CDC here in Atlanta, they did the initial ACE study. And what they did is that they looked at adults and they asked them questions about their childhood and whether they had faced things such as psychological abuse, physical abuse, sexual abuse, witnessed domestic violence, had dysfunction in the home, such as an incarcerated parent, or had parents that used substances, and things of that nature. And what he did is he gave them an ACE score, and he correlated those findings with health risks. So behaviors such as smoking, substance use, alcohol use, increased risky sexual behavior, lack of physical activity. And then he also looked at actual disease states. So diabetes, chronic bronchitis, heart disease, stroke, depression, COPD. And what he found was that there was a large correlation with the higher your ACE score, the higher you had of having risky health behaviors and also actual diseases. Since this was back in 1998, since then there have been many more ACE studies done that have reproduced his initial findings. So we know that there's something there. And when people think about ACEs now, 20 some years later, that's 25, I guess, 26, we do the math. You have to think about other things such as living in a war zone, poverty, food insecurity, systemic racism. So there's ACEs, adverse childhood experiences, are anything that can affect the environment of a child in a detrimental way.
Fascinating. So what do you wish, as a pediatrician who specializes in working with victims of ACEs, what do you wish people understood about the long-term effects of these childhood traumas?
Mm-hmm. So we know that childhood trauma, again, can fall under many different categories, can impact your health and well-being as you age. It is also linked to premature death, by the way. So when we're looking at the health of children and families, it's not just about going to your well child check and getting your vaccines, although those things are important. But we really have to look at the health of the whole system, because that does impact adults, and those adults are going to have kids, and it's going to be generation after generation after generation if we don't look at the problem from the beginning.
Hey, Doc, hold that thought. We got to take a station break, but we're going to come back because we got a lot more to dive into. And I tell you, whichever platform that you're watching this on, I know you're excited already. If you want to be part of the show, all you have to do is go to the comments. Ask any questions that you might have. I promise you, we'll get you an answer. Or you can pick up the phone and dial 1-888-344-1170. Again, that's 1-888-344-1170. Remember, it's your life. And we'll be back shortly after the break.
There's more stories of greatness to help you overcome adversity coming up on It's Your Life with James Cooley.
A Black Man's Point of View is the newest Amazon.com #1 release and bestseller book.
The James Cooley Show. It's your life. Dr. James JC Cooley. Hey.
Really get a chance to know who you are. And once you know who you are, you truly know who you are, love who you are. Love who you are. You're a masterpiece. Love who you are. Love who you were born to be. Love me some me. That's what I'm talking about. When you leave high school, you gotta know today or tomorrow, hopefully today, what your plans are. Hopefully, there is no bad decision unless there is no plan. Create, collaborate, commit with confidence. Commit with what? Commit with what? And everything that you do.
Noah Dingley here, producer of The James Cooley Show, It's Your Life. And the new audio version of James' book, Country Boy, City Boy, A Journey That Ain't Over Yet, is a must-have. James shares his true life story of struggle and success in America. It's both a cautionary tale and a roadmap to achieving the American dream. Get the new audio version of Country Boy, City Boy, A Journey That Ain't Over Yet by James Cooley on Amazon.com or wherever audiobooks are sold. Noah Dingley here, producer.
Get your copy of Country Boy, City Boy, A Journey That Ain't Over Yet by James J.C. Cooley, available on Amazon and everywhere books are sold.
Let's go. It's the James Cooley Show. It's your life.
Yeah. Welcome back to the James Cooley Show. It's your life. And I tell you, having fun already? Having fun already, Doc. And it's so much about this young lady we can really dive off into. And I hate to say it, but we're going to discover it all. We're going to pull all of that knowledge out so she can share it with the world. And that's what knowledge is all about, is being able to share with the world, share with others, and hopefully somebody would take that knowledge and turn it into understanding. Let me say that again. Grab the knowledge, take it, and turn it into understanding. And that's how we learn. That's how we grow. That's how we mature. So I tell you what, whichever platforms you're watching us on, all you have to do is just go to the comments in that platform and ask this young lady or Dr. Michael, myself, any question that you might have. I promise you, I give you my word, we'll get you an answer. Or you can go the easy way out, which is cool. You can pick up the phone and dial 1-888-344-1170. Again, that's 1-888-344-1170. I'm going to start it off, and then I'm going to turn it back over to Dr. Mike. Dr. Brown, now, I know you were talking about the effects of ACE and brain development, long-term health outcomes. And one of the things that I was thinking about doing that when you was explaining that to Dr. Mike, what are some of the signs and symptoms of that people need to be aware of?
Sure. So when we think about an average childhood experience, whether it is a situation of child sexual abuse, for example, or, chronic poverty and hunger, right? Because they're all different points in this ACE scoring. When we think about high ACE scores, especially 4 or more ACEs, we have to think about the effect of chronic or toxic stress on the body. And what we know is that when you have chronic stress and chronic inflammation, it can lead to different sorts of illnesses. And what's interesting about chronic stress and ACEs is that we know through studies in something called epigenetics that chronic stress and adverse childhood experiences are linked with changes in the structure of your cells. So we have DNA, a process takes place called methylation. We're not going to get into that because it's kind of nerdy. But what happens is that methylation of your DNA strands can change the way that your genomics acts. And so that can be linked with the disease states we talked about, especially mental health illnesses. And we also know because of epigenetics, there are changes that can actually happen to brain structure. For example, decreased size in the hippocampus, structures in the different ones. We won't get into brain anatomy right now. But we do know that there's something to that, and that is linked with depressive disorders. So there's something that happens with those changes in DNA. Now, by the way, this is not permanent necessarily. There's ways that we can change those things, but the field of epigenetics is very new, and so we're still very much learning those things. But we know that trauma is inheritable. One of the things that you as a therapist probably have heard 5 million times, trauma begets trauma. Well, we know that because of environment, but actually you know that because of epigenetics. So when we look at studies, for example, of pregnant women during when the World Trade Center fell, they looked at cortisol levels of the kids of the pregnant women, and especially if you were in your 2nd or 3rd trimester during that situation, that horrible situation, those children have been seen to have higher cortisol levels. Right? So it is a biological thing. It's not just pull yourself up by the bootstraps and keep it going, right? So we have to be able to not only look at, okay, so now you have diabetes, you have a high blood pressure, all those good things that happens to everybody, the biggest killers in America, right? Depression, so many people with depression. But what are we doing, not just from the prevention standpoint of educating about like eat your vegetables, do yoga, all those things are great. But what are we doing for the society and the systems in making sure that our families and our children are being taken care of from an emotional and environmental standpoint, so that we can create those structures of safety so that parents can parent better and get the resources that they need, and that children can grow. Even if your parents had high ACEs, you don't have to. And then we can change generations that way. So not only we're going to impact mental health, well-being, people being happy, but also all of these diseases that kill Americans every day.
So let's talk about the broader role of society, one's community, one's school. From the perspective that you have right in the center of working with those who've experienced these unfortunate realities of ACEs, what role do you see community, society, schools playing in exacerbating or helping those who've experienced ACEs?
It's huge what can be done. I think that it depends on where you live, as far as your politics and what's actually happening at the ground level of the community to be able to provide services that are helpful. So I can't speak of every community in America. But what we know is that if we fund programs that help parents and children, we can prevent a lot of things. So for example, this was from the CDC, and I was actually a little surprised at how high the statistic was. I knew it in my heart, but I didn't know it in the numbers. That if we fund early preschool education, and then programs that help mothers of infants, so visitation programs of new mothers. Those things together can decrease the child abuse rate by 48%. That's huge. I probably wouldn't have a job, which would be fine. I can do other things.
Right. Find something else to do.
But think about how much we would be saving as a society if we just had safe spaces for babies and helped mothers of newborns, and then had them have preschool systems that people can actually afford to send their kids to. I don't know if you have any preschool kids, but it's really expensive, right? It's not for everyone. So that's one of the things. We know that by giving support for parents, like, for example, parenting services, parenting classes, or even just how to teach kids as they grow up and teens how to manage emotions, how to manage anger, how to manage the really tough feelings, and give them those tools to filter those triggers, you're going to lower incarceration rates. You're going to increase the rate of kids finishing school, high school, and going to college. You're going to have just a much better society. So those public programs can be a huge benefit, and just communities in general. What are your religious communities doing? What are in general, like, what are people doing for the kids and the families?
The Surgeon General of the United States over the last week or so, but particularly over the last couple of days, I think because it's back to school, has been talking about the role that stress plays in amongst families, and it's astronomical. The impact is so felt. We don't think of stress as an obvious, sign, but it does take it does impact people. Talk a little bit about the role that stress plays on children, especially as we're going back to school and trying to get everything, organized. What about that?
We are facing an epidemic of suicidality in teens, right? That's a number. That's a data point that we can see, that stress and mental health issues that are not taken care of are affecting our kids. And life is fast. Even if you are in a perfectly nice situation in your life, life is fast. We're always doing something as Americans. We're always going, here, there, everywhere. And expectations can be high, right? And so sometimes even those sorts of things that are not necessarily adverse are going to impact your mental health through burnout. So that's another thing. So it's so multifactorial. But we do know. Sorry, go ahead.
That brings me to the issue of it. When a parent brings a child to you as a pediatrician specializing in ACEs, you must be taking care of the whole child, the physical difficulties, the illnesses, but additionally paying attention to the emotional difficulties that led to this in the first place. We're going to toss this back to JC, because I know we have a break coming up. But perhaps we can talk about the role of, the whole person health that you bring to your work.
Wow.
So
we got a minute. You can start it, but only got a minute before we go to the break.
So I think that it's really important. In our clinic, we see a lot of survivors of sexual abuse, a lot of kids with a lot of teenagers, boys and girls, but a lot of girls. And in those particular times, it's really important not just to assess what's physically going on in their bodies, STI testing, injury, all those good things, but also what's going on in your mind and in your heart. And those are some really important conversations that we have to have at the bedside.
Wow. I tell you what, we got so much that we're going to dive into now. I know that I'm looking at the numbers. I know who's watching and who's not. So if you want to be part of the conversation, whichever platform that you're watching us on, all you have to do is go to the comments, ask any question that you might have. Or You can pick up the phone and dial 1-888-344-1170. Again, that's 1-888-344-1170. KCBQ, the answer out of San Diego, FM 96.1, AM 1170. The James Cooley Show is your life, and we'll be back shortly after the break.
There's more stories of greatness to help you overcome adversity. Coming up on It's Your Life with James Cooley.
Craving a slice of Chicago right here in Temecula wine country? Then dive into legendary Chicago deep dish style pizza at Rosati's Pizza Pub. Piled high with gooey toppings, Rosati's delivers the taste of the Windy City right to your table or front door. Enjoy the cozy pub atmosphere and an impressive selection of
The James Cooley Show. It's your life. Dr. James JC Cooley. Hey.
We live in a world today that people don't even care about how people see them. Don't realize that we can affect an entire generation and build our character. But you gotta do it with these 4 C's. Create, collaborate, then you commit with confidence. Create, collaborate, then you commit with confidence. It's the 4 C's. It's the 4 C's. In this life you are gonna grow, but there's things in this world that you gotta know. To be the best that you can be, you wanna grow real big into a strong tree.
Dr. James JC Cooley. The James Cooley Show. It's your life.
Welcome back to the James Cooley Show. It's your life. I'm your host, Dr. James J.C. Cooley, and I tell you, I'm sitting back here listening to this young lady, and she's talking about a lot of different things that are so important to all of us, especially when it comes to our kids, adults, trauma, and behavior. Let's not forget about behavior. Because that's what it's all about. And a lot of times, in order for us to change our behavior, we have to understand what's going on currently. We have to understand. And Dr. Brown is laying out a roadmap. She's laying out so many great things that need to be discussed and need to be talked about. I tell you, Dr. Brown, I am excited, and Todd, this is your time. You know, this is the 1 minute Todd, the 1 minute Todd feedback. Todd, what do you think about the show so far?
Well, I think it's a great show, and it's a good one for our listeners out there that are parents to know how important it is to raise your kids right. And I think it's a great show. Let's get right back to your guest.
Let's get back to the guest, and I tell you, audience, with your platform, I have to keep telling you this. With your platform that you watching us on, you want to be part of the conversation, jump into the party. ask any questions that you might have through the comments portion, or you can just reach out and call Todd. Todd will put you through. So hey, I want to start off, Dr. Brown. You talking about the ACE? You're talking about all of these great things, and trauma. Trauma is probably the most scary thing about everything that we do. And so, how has trauma-informed care evolved in the recent years, and what changes have you seen in your practice to help resolve or help educate or help put at ease, because we probably can't get rid of it? Can you talk about that a little bit?
So trauma-informed care honestly should be part of all medical care. And I am thankful that there is a growing body of clinicians everywhere who are understanding that and taking the initiative to learn what that means. I think in pediatrics, we do, I do say so myself, a pretty good job, because we are, you don't have to do child abuse pediatrics, even in just your general practice. We are looking at family units. And so I think that's probably one of the reasons why pediatrics is in the forefront of trauma-informed care in many ways. But, back in the day, you would go to your doctor many times and like, well, your blood pressure is this, and, you need to lose some weight and you take this medicine. And I think it can still be that way in many practices, but I think we as a medical body are understanding that we have to go a little deeper about, well, what is actually happening? Why is your blood pressure all of a sudden high? Right? Is there a stress going on in your life? Did something change, right? And then hopefully being able to refer to the right services. One of the big problems, though, is that there's a paucity of mental health professionals in the United States. There's a shortage. Anywhere from 1/3 or 1/2, depending on the statistics you look at, of Americans live in an area that is underserved for mental health. This is especially true for pediatric mental health. So sometimes, even though you find the culprit and that maybe you are in a very stressful situation, you need help talking to somebody, sometimes it's hard to find that help.
Wow. So Dr. Brown, what are the recommendations as far as research is concerned, how this help can be found, or how to represent underserved communities, especially when it comes to pediatric healthcare, mental health care?
That's a hard question. We need more people getting trained in it, and wanting to do the work, but it's a hard work to come by. It's sometimes undercompensated a bit. Insurance does pay for a certain amount of mental health help, but sometimes it's also really expensive depending on your insurance plan, or if you have insurance at all. And when to your question of equity, one of the big issues that we see is that there is a correlation with higher ACE scores with minority communities. So, and if you think about that, makes sense, because if you think about just the broader aspect of an ACE, right? So for example, in the United States, 1 in 5 children suffer food insecurity. That's 44 million Americans that are food insecure, and 7.5 million children. And if you're hungry, it's really hard to be functioning at your best, right? Or doing school well, or paying attention, or things like that. Right? That's one thing. That's huge. Poverty. 11% of Americans are under the poverty line, but if you look at the percent of that 11%, 17% are Blacks, and 17% are Latinos, and 23% are Native Americans. So, our Black and brown populations are affected greatly by this inequity. And then if you look at just in general, good public education in schools and all of these services, again, it depends on what your community has to offer. And those things are not necessarily available, especially in very rural communities, or even depending on very urban centers.
Dr. Mantell?
Yeah. I have so many questions. I don't even know where to begin. We talk about good school. We have 2 minutes left. Great. All right. We have talked about good schools. To me, a good school is not one that teaches algebra well. It teaches kids, people how to think well. My teacher, Albert Ellis, is famous for saying, show me one thing that happened in your childhood that you think affected you, and I'll show you it wasn't the thing, it's the way you thought about the thing. Now, how does that sit with your experience sitting with kids who have had really harsh experiences, physical, emotional, sexual, you name it? Is it the event, or is it the way kids are thinking about the event? And can we teach them to think about these events differently? With a minute or two left, I'm not sure how much we can get into it, but please, let's start with that. What do you think, Dr. Brown?
It would take me a whole hour to answer that question.
Okay, let's do it.
Because it depends on the trauma, right?
Yes.
You know, a sexual assault trauma is going to be very different than if your whole family is suffering from poverty, but you're suffering together, and there's love there and all those things. Because when you look at what helps mitigate the effects of ACEs is resiliency effects. And what are those? Those are having people in your family and community who love and support you and listen to you. You know, feeling safe, at least with one a particular adult or one particular system. So we can't shortchange the importance of our teachers, the importance of our community figures in nurturing our families and our kids.
Nurturing. Hold it though. I want to come back to that term, nurturing. We're gonna take a station break. Oh, we got so much we want to talk to these kids about, and I tell you what, we're gonna pack it in the last 9 minutes of the show. It's not too late if you want to be part of the conversation. All you have to do is just go to the comments, ask any questions that you might have, or pick up that phone, dial 1-888-344-1170. Remember, it's your life, and we'll see you shortly after the break.
There's more stories of greatness to help you overcome adversity coming up on It's Your Life with James Cooley.
A black
Craving a slice of Chicago right here in Temecula wine country? Then dive into legendary Chicago deep dish style pizza at Rosati's Pizza Pub. Piled high with gooey cheese, rich tomato sauce, and your favorite toppings, Rosati's delivers the taste of the Windy City right to your table or front door. Enjoy the cozy pub atmosphere and an impressive selection of Temecula wines. Come on down to Rosati's Pizza Pub for your slice of Chicago right here on Rancho California Road, or order online at myrosatis.com. Rosati's, where Chicago deep dish pizza meets Temecula charm.
From Amazon.com or wherever books are sold.
The J.C. Cooley Foundation is a nonprofit.
Dr. James J.C. Cooley from the United States of America, and I am here to just say, first of all, I'm so happy and honored to be to be in the Coffee Book 2023, Unified Brain Z and the other organizations. Thank you so much for giving me an opportunity to be a part of this collection.
Hello, welcome back to It's Your Life with Dr. James J.C. Cooley. We are here with Dr. Michael Mantell, our co-host, and Dr. Verena Brown, our guest today. And our topic is 360-degree health, effect of adverse childhood experiences on adult wellness. And if you want to be part of the show, please, whatever social media platform that you're looking at the show, please send Dr. Brown a question or comment and just let us know. So, Dr. Brown, we want to leave off where you started before we took our station break. Dr. Michael Mantell, can you just repeat the question you had for Dr. Brown?
I wish I could.
Oh.
We were talking about what the issue of whether it's the event or is it some combination of the event and the way we think about the event. In terms of dealing with children, as I was a chief psychologist at Children's Hospital here for a number of years, and dealing with kids with trauma. The trauma happened many years ago. Okay, what can we do now? Well, we need to think about that trauma, deal with it. We need emotional support that you were talking about, community support. So that's where we were going. And you said that opened up a whole at least hour worth of thought. So let's talk about that, Dr. Brown.
Yeah, so when it comes to trauma, and you're going to know so much more about this than I am in so many different ways psychologically, but it's the way that the trauma intercalates in your body when it happens, right? So if it's a chronic situation and chronic stress, then you're going to have that cortisol response continuously leading up to inflammation and things like that. And there is thought to think about that, you're going to have some triggers that maybe you don't even know what those triggers might be, right? If it's a trauma that happened one time, that could still be extremely life-changing, such as in the case of, our teens who are sexually assaulted. The thing that I think is really important to notice, especially if you are a parent or if you're an educator, if you're dealing with children at all, is that, kids aren't bad, right? If you see a child who is behaving in a way that maybe you don't particularly like your teacher and they're acting up in class, right? Or slumped over and they're not answering any questions and things like that. Making the assumption that, that kid just has a bad attitude might actually be the worst thing, because maybe that kid is just constantly traumatized because they're reliving that trauma. They don't know what to do about that trauma. They're feeling all sorts of emotions that they don't know how to deal with because they're children.
Right.
They act up in different ways.
A child who a child who has seen a father beat up a mother, or a mother doing God knows what, drugs or something, you don't just get that out of your head the next day you go to school. So we need professionals like Dr. Brown to educate people, to say, schools, pay attention this way, religious institutions, pay attention this way. This is an enormously important medical specialty for long-term health.
I believe that it's so important. Just like with my show, we're getting this out because it is so important. And I also believe not only parents, communities, I think the policymakers, I believe that the legislators, I believe that healthcare providers, I believe it's going to require everybody to, first of all, get an understanding that this problem is bigger than what they might think, or that maybe everybody might know that it is bigger, and they don't want to be a part of it from a political perspective or whatever that is. And I think we have to get rid of that mindset. And Dr. Brown, what are your thoughts on that?
Amen. All of those things. you said. We do. We need to pour into our children. I think that's really the bottom line. We need to pour into our children and pour into our families and nurture our children and our families, because you know what? For example, you know, when I'm in clinic and I have a child there, say elementary school girl, just generic, and she maybe has been sexually abused by a relative multiple occasions, right? And finally had the courage to say something to someone, which a lot of kids don't disclose, by the way, but that's a whole different show.
Mm-hmm.
You know, a lot of times I'll talk to the caretakers who are there, which oftentimes might be mom, who is now devastated that this happened to her child and doesn't really know what to do. But one of the questions that I always ask is, so tell me your trauma history. Did anything like this happen to you? And I will say that the majority of the times, the answer is yes. Well, did you tell anybody? No. Or yes, I did, and no one believed me. Did you ever get any help? No. You know, so for caretakers, for parents, for the grown-ups in these kids' lives, like, it's true, put on your oxygen mask first. Make sure that you're taking care of the things that hurt you, because you'll be more apt to help your children with whatever life brings their way. You'll be a better caretaker in general. And if something bad does happen that is outside of your control, you can huddle together and support each other in a much healthier way. But as far as institutions go and our policymakers, yes, you know, there's only so much that you can do. I mean, like people say, you know, pull yourself up by the bootstraps to get it together. But if you don't have thread to make bootstraps with, what are you going to do? And so 100% pour into our children and our families. I think if I were president, that's what I would do.
Let me say this before we go any further. Is Dr. Brown, if your schedule permits, I would love to have you on for part 2.
I would love to.
Because this is so important. And I think we need to talk about this a lot more. So, Dr. Mike, if you
absolutely, we are going to make this happen. Hey, I know we don't have a lot of time left, but real quickly, when JC and I were kids, childhood traumas were things like being bullied on the playground. Sexual trauma, we didn't hear about that. Today, we hear about that. We know about that. But you know what else we know about? We know about kids who are I get choked up saying, who are walking to school and seeing a gang of kids beating up a bunch of other kids, going into a store, breaking into a store. Kids are walking around with such terror. And you don't want to get into the brain business of the hippocampus and the prefrontal cortex and the amygdala and all that business, but there are kids who are constantly scanning their environment. They're very out external, looking at every little thing. Who's going to beat me up? Who's going to get in trouble? And they're kids who are very internal. And we need to know how to get into this. And that's why it's so important to have you come back and help us understand these different approaches and what we can do to help children living in the streets of America today.
Thank you. Happy to return.
Well, we just like this is so important, and every time Dr. Mike brings a guest on, I mean, I sit back and I learn, and I'm amazed of this guy because he only brings the best. And if they're not the best, they don't get invited back. I'm just gonna be real with you. We have our pick of the litter, but I want to thank you so much for your wisdom, your understanding, and your focus, and sharing with the world. And we got to have part 2 because it's a lot of things that we did not cover here. So, Dr. Mike, make it happen, please. I'd like to thank Dr. Michael Mantell. I said partner in crime, not crime. I'm talking about, but saving lives and bringing and educating others. I'd like to thank Dr. Michelle Cooley. Wow, I don't know what I would do without our executive producer, who is the boss. I'm not the boss. Who is the boss? Who makes everything happen? I like to thank Todd Pirate, my absolutely wonderful producer back in California, that make everything happen. But most important, I like to thank our viewers and our listeners for tuning in to the James Cooley Show. It's Your Life, Monday through Friday, 2 p.m. Pacific Standard Time. And also Saturday at 10 p.m. to 11 p.m. Sunday at 10 a.m. to 11 a.m. Remember, always dream big, think big, be big at everything you do. Guess what? We'll be back tomorrow, same time, same place. It's Your Life, and we'll see you.
Hi, this is Ken Anderson from Walter Anderson Nursery. Garden Talk is back on the air.